The National Agency for the Control of AIDS, NACA, is constantly engaged in activities targeted at ending new HIV infections and AIDS-related deaths by 2030. Hello and welcome to another episode of The Last Mile with NACA. I am Adesua Osui. Today's episode brings you highlights of some of the agency's efforts in conjunction with stakeholders towards fighting AIDS to finish. We start with the launch of a youth-centered intervention that aims to scale up the uptake of high-impact HIV prevention tools. Keep watching.
In a bid to scale up the uptake of HIV-impact HIV prevention tools among vulnerable groups across the country, the federal government of Nigeria and implementing partners have initiated numerous interventions. Following the report from the mode of transmission study conducted in 2020 that analyzed the distribution of new HIV infections in the country, the National Agency for the Control of AIDS, NACA, in collaboration with UNICEF and relevant stakeholders, recently launched YAah Naija, an innovative HIV prevention intervention for adolescent and young people who represent a growing share of people living with HIV. YAah Naija is an acronym for Youthful, Alive and Healthy in Nigeria. The welcome address was delivered by the Assistant Director, Community Prevention and Care, Ezine Uchendu, on behalf of the Director General, NACA, Dr. Gambo Aliyu.
YAah Naija is an innovative HIV prevention intervention for adolescents and young people between the ages of 15 to 24 years. It is a flagship national HIV program for adolescents and young people driven by the government of Nigeria. NACA is driving the process, and the AYPs, the adolescents and young people, are fully in charge, supported by other partners. YAah Naija is aimed at improving the uptake of two high-impact HIV prevention tools. For YAah Naija, we are looking at HIV self-test and also PrEP, the pre-exposure prophylaxis uptake among adolescents and young people in Nigeria. For this project, we are piloting in 3 states, Anambra, Lagos, and Rivers States, and they are all represented here. If we are able to get our interventions right for this target group, the adolescents and young people, will be able to reduce HIV infection in Nigeria.
In his address, while reeling out global HIV and AIDS statistics, the country director of UNAIDS, Dr. Leo Zekeng, opined that inequality continues to fuel new infections among young people.
Despite of the remarkable progress that we have made in the AIDS response, AIDS is still a health and a developmental challenge. From the global perspective, 2021, 38 million adults and children living with HIV and AIDS. 2021, 1.5 adult and children newly infected with HIV and AIDS. And in 2021, 650,000 people, adults and children, who die because of HIV and AIDS. This is quite a lot. We know what we have to do, but we're not there yet. So inequalities continue to fuel the AIDS response. I just want to give you an example. Young people aged 15-24 represent about 15% of the population worldwide, but they account for about 1/3 of new infection. And the toll is huge among adolescent girls and young women. So Nigeria is the 3rd largest epidemic in the world. And if we look at the data of 2021, there are about 1.9 adults and children living with HIV in this beautiful country. It is estimated that in 2021, we had about 74,000 new infections and 51,000 adults and children die because of HIV and AIDS in Nigeria in 2021.
Speaking further, Dr. Zakeng made emphasis on access to services for adolescent and young women.
Among young people, mostly in the room, the HIV prevalence among female is more than double that of male. It's about 0.7% for the young female and 0.3% for the young male. Comprehensive knowledge among young people and adolescent girls is still low, at about 29%. Condom use is equally low, and also access to HIV testing. So it is important, and this is one of the key messages, that whatever we're doing about HIV prevention, we should ensure that we're reaching adolescent girls and young women. YAah Naija continue to engender innovation, youth engagement in the HIV space, and I'm confident that we shall have more HIV competent young people who in turn will turn the tide of new HIV infection. We have what it takes. Let's join hands and make it happen. And I'm excited about the YAah Naija because it is using technology. It is using technology, friendly technology, to ensure that we can have access to knowledge, we can have access to services, and we can continue to engage, so the young people. I want to commend NACA for the leadership.
Commending Nigeria for its efforts in the HIV response, the Chief of Health, UNICEF, Dr. Eduardo Celades, and Celine Lafaucrière, Chief Field Office, both pledged the organization's continuous support.
I'm the lead of Generation Unlimited, which is also called YAah Naija. And we are basically leading an initiative which is here to support young people, those beautiful young people, from 10 to 24, move from learning to earning. But we're also here to support any kind of programs that ensures that they will be youthful,
alive, and
healthy. YAah Naija, because we need them to be healthy, we need you to be healthy. And as Eduardo was saying, youth are the leaders of today, and this is exactly what this represents here. They are leading us. We're just giving them the tools that we have, but they're leading us. So we're here to support with volunteers, genuine volunteers. We're here to support innovation. We're here to deliver beyond health skills and jobs and livelihood opportunities. And we're here to support this because we're true believers in good health and fighting HIV and AIDS once and for all.
We as UNICEF, we stand with youth, we stand with HIV response, we stand with innovation, we stand with change. We are here for you. And this is not only one day, it's a long-term commitment. As soon as you are youth, we are going to be with you. In the coming months and years, UNICEF will continue to work with you and other stakeholders. Young people, today is your day. It's a day to celebrate you and to help amplify your voices. We are saying that today we want a media storm. We already have a storm outside, but we want a media storm that goes beyond Abuja, beyond Lagos, and goes to the world. Please seize this moment, seize this space. Let's create a storm. You cannot be ignored. I challenge you to do more. As well, Nelson Mandela he was saying, it always seems impossible until it is done. And today we are doing it. I would like to congratulate NACA for its leadership of the national response to HIV, and especially for leading the adolescent and young response for HIV.
UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 695 cases. This indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
About 200,000 children born HIV positive, over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades.
The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV-positive pregnancy is prevented from transmitting that disease to the newborn.
The HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
The National Coordinator, Association of Positive Youth in Nigeria, APIN, here on Sunday, lauded the YAah Naija initiative.
I would sincerely want to appreciate the government of Nigeria, NACA, and UNICEF for always being there for adolescents and young people. YAah Naija started as an initiative, but you can see it's more than an initiative, it's a movement for adolescents and young people. It has activated all the blocks that is required for us to address HIV situation and response within the context of preventing and also closing the tap. We are opportune as young people to be part of this process, leading it at the forefront. As such, we appreciate you and we wish to see the success of Nigeria where the epidemic is controlled and no adolescents and young persons are getting new HIV infected.
Goodwill messages were also delivered by representatives of Global Fund, FHI 360 and JHIPIEGO, the Federal Ministry of Health, Ministry of Women Affairs and Social Development.
If you look at the mandate of the Federal Ministry of Women Affairs, the ministry has mandate for women, children and young people. And looking at the statistics, we notice that the young people are very much involved. And that is why the ministry has a desk that is dedicated to creating awareness on HIV/AIDS among young people. And it has become a priority that anywhere we go, we are always going to schools, we are always going to communities. If the young people are healthy, by the time they grow into adult women, they are also healthy. And they will give birth to healthy children. So I congratulate the initiative and we are ready to partner with NACA to carry awareness forward to schools and communities.
Improving adolescent and young people's health is very dear to the Federal Ministry of Health, the Honorable Minister of Health's heart. And I'm happy to see young people being ably represented here. We would like to urge young people to maximize this opportunity to ensure that issues concerning young people's health, especially as it relates to HIV/AIDS, is well captured. Because we in Federal Ministry of Health believe in proper engagement of young people in providing adolescent responsive health care. And we believe that you can't plan for young people's health without involving them.
Highlight of the event was the official launch of YAah Naija. The project will work with adolescent and young people peer networks and geolocalization tools for targeted service delivery, referral and linkages, support capacity strengthening, evidence generation, and dissemination to achieve sustainable HIV outcomes at scale. This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
As they say, catch them young and watch them grow. YAah Naija. Up next is a 4-day stakeholder meeting on the National HIV and AIDS Strategic Plan for 2022 to 2026, organized by NACA. Don't go away.
The National Agency for the Control of AIDS, NACA, with support from the World Health Organization, UNAIDS, and other partners, recently concluded a 4-day national stakeholders engagement for the development of National HIV and AIDS Strategic Plan 2022 to 2026. The hybrid event had in attendance representatives of community and faith organizations, health professionals, and other relevant stakeholders. The Director, Policy, Planning and Coordination, NACA, Dr. Funke Oki, explained the significance of the event.
Nationally, we have had the National Alignment 1.0, which was a partnership between the government of Nigeria, PEPFAR, and Global Fund. And that alignment has been adjudged a huge success. And we're already moving to the National Alignment 2.0. We are also transiting the Abia and Taraba program of the government of Nigeria gradually to the states. Basically, we're saying Nigeria is in a transition period. We're bringing on board every other state, actually, in this process. And all these things are culminating into a sustainability plan for HIV and AIDS in Nigeria. In addition, we have made efforts to improve non-health sector data reporting by ensuring that non-health sector issues are in the sustainability plan that is being developed for Nigeria. So like we said, it is a transition period, and we are close to achieving the epidemic control that we have been trying to achieve all these years. So because this era is significant, the national strategic plan that we're developing is very significant because it is the document that will guide the entire process in the next 5 years.
The National HIV and AIDS Strategic Plan 2022 to 2026 provides stakeholders across the nation with a roadmap to accelerate efforts to end the HIV epidemic in the country by 2030. Discussions bordered around prevention of new HIV infections, improve HIV-related health outcomes of people with HIV, reduction of HIV-related disparities and health inequities, achieve integrated, coordinated efforts that address the HIV epidemic among all partners and stakeholders. The 4-day National Stakeholders Engagement on the development of the National HIV and AIDS Strategic Plan 2022 to 2026 was highly interactive, and resolutions adopted will be instrumental in achieving national set targets.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching. And as we draw closer to the 2022 World AIDS Day celebration on December 1st, let us equalize to end AIDS. Do not stigmatize or discriminate people living with HIV. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osui. Goodbye.